Hi everybody, welcome back to my YouTube channel, What's on my mind with Sana Khan. In this video, we'll be talking about the different types of PCOS as the approach to them or to treat them is different. What does PCOS stand for? It stands for polycystic ovary syndrome. Now, this is a hormonal disorder which is caused by imbalance of hormones. So, there are few basic or common symptoms associated with it, using which you might be able to, if you notice this, you might have to go ahead and get yourself tested. So, these are obesity, cystic acne, excessive facial hair growth, and irregular or no periods at all. So these are some of the physical symptoms. However, I'll get into the specific symptoms once I talk about each type of PCOS. So let's get started with the video. Now, the first type of PCOS is insulin resistance. This is common in 70% of the people who have been diagnosed with it. Now, this means that there is an increased level of insulin in one's body, which is called as hyperinsulinemia. Your cells become numb to insulin, due to which your body starts pumping excessive levels of insulin, and that in turn increases androgen levels in your body. Now, androgen is a male hormone, and because of the increased levels of this is why you suffer from symptoms like excessive hair growth or hair loss or irregularity or no periods at all. This is because of the increased level of androgens. Now, for us to detect this, along with the ultrasound, we need to get glucose or insulin tests, and depending on the results, your doctor will be able to tell you if you suffer from insulin resistance. So, the second type of PCOS is Postpill PCOS. As the name suggests, this occurs in some people after they stop taking contraceptive pills like Jeanette, Yaz and Yasmin. This is because of the synthetic progestins used in this. Now, there is as soon as you come off the pill, there is a natural surge in androgen levels which causes the PCOS. However, there is no insulin resistance with this type of PCOS. But you might experience acne, hair loss and weight gain. You will be able to easily identify this or notice this if you come off the pill. But the good thing with this is a lot of people, if they wait out for 3 to 6 months after they come off the pill, it naturally, the hormones are naturally balanced within that period and all the symptoms go away. If not, you can go ahead and take supplements needed for it after you consult your doctor. So, the third type of PCOS is adrenal PCOS. This is due to abnormal stress response, and this affects around 10% of the people who have been diagnosed with it. This is due to an increased level of one type of androgen, which is called DHEAS. Unfortunately, this is not something that can be detected using ultrasound. You might have to go through your endocrinologist or a specialist for this to be detected. Now, the symptoms associated with this are very similar, or the common ones that are with other types of PCOS, like obesity, irregularity of periods or no periods at all, and sometimes for some people they get very heavy periods, and you feel anxious or night anxiety especially, and food cravings. So these are some of the symptoms that are associated with this. Now, the treatment for this is supplementation, at the same time sleep management, which is very, very important, and management of your food or the change in diet. The fourth type of PCOS is inflammatory PCOS. The chronic inflammation causes or makes the ovaries produce excess levels of testosterone, which results in physical symptoms of PCOS as well as issues with ovulation. Now, with this, the major symptom would be irregularity of periods or anovulation, sometimes with some people. So, the main or important way to treat this is you need to repair your gut or take care of your digestion, and if you have a leaky gut problem, you need to take care of that, or the bacterial growth in the stomach. So you need to basically balance or focus on your gut health, and at the same time supplementation is required if you have chronic or the PCOS symptoms, the physical symptoms, or you have problem with your periods. So supplementation is very important in this. However, for all of this, no matter which type of PCOS you have, along with the diet changes, it's very important that you consult your doctor and to rule out what kind or what type of PCOS you might have. You might have to get tested, and there are basically two types of tests which would really help you. One is ultrasound, just to know if your ovaries are polycystic or not. So even if there are no cysts, sometimes the ovaries itself are they are polycystic. So that is one. And the second thing, like I mentioned, for you might have to get your blood levels tested. That will help with the PCOS. Unfortunately, like I mentioned, for adrenal PCOS, you might have to go to your endocrinologist. Once you're able to detect this, the approach to this is different. As I mentioned previously, you can go ahead and take the supplements needed, and you can only target the areas, or you can only target the symptoms you want to treat or you want to manage, reverse it. And lastly, I would like to give you a few tips or a few changes that can be made, using which you might be able to manage any of these PCOS. One is cut back on caffeine. Second, cut back on dairy and sugar products. The third would be, and very important for all types of PCOS, is sleep management. And the fourth one is you need to make sure that your gut health is perfect. So if you're able to manage these things, a lot of physical symptoms will be managed. So even after that, if you need to get any supplements or any medication, you can go ahead and consult your doctor and do this. I hope this video was helpful, and if there are any suggestions or if you want to know anything more about this or about my journey, you can comment it, or you can directly DM me on my Insta. Thank you so much for all your support. Please like, share and subscribe. I'll meet you in my next video. Thank you.